This question asks, during a patient's intake, which of the following would be considered part of the patient's social history? So in order to fully understand this question, let's make sure that we understand what social history entails. So when you're intaking a patient and you're asking questions about their medical history and their conditions that they have and all aspects of their life, part of this is their social history, which is kind of like their lifestyle history. So we might ask questions about what they do for a living, such as their occupation, what type of exercise they do routinely to stay active, so their activity level, maybe what their typical diet looks like, and what type of practices that they have. So do they have any hobbies? Do they have any interests? And do they use any recreational drugs or alcohol? So drugs and alcohol is part of this. ETOH is a shorthand for alcohol. So now let's go look at the choices and see which one matches this idea of social or lifestyle history. So option A states previous surgeries. So their previous surgeries do in fact relate to their history. However, this is referring to their medical history, their surgical history, what kind of conditions they've had in the past, but this is not considered part of your social history, which more has to do with the patient's lifestyle. So we can eliminate option A. Let's take a look at option B. Option B states allergies, and although this is important to note on their medical history and know how to best take care of this patient going forward, this again does not relate to lifestyle as we look at over here, and therefore we can eliminate allergies or option B. Option C states family history of heart disease. So this actually relates to what's listed here, family history. And the provider might create a family tree to watch how diseases are passed down through generations, but this is different than a social history. So we can eliminate option C as well. And then option D states tobacco use. And if you look at tobacco use, it looks very similar to what we discussed over here with their lifestyle. We see drugs and alcohol is listed as part of it. And tobacco use is in fact a drug. So this relates to their lifestyle or their social history. So we could choose option G because that looks correct. Tobacco use as being part of the patient's social history.